Welcome to UNC Health, Bariatric Surgery, Informational Slideshow. On behalf of our team of surgeons, dietitians, psychologists, and nurses, I welcome you to learn more about the process to weight loss surgery. Determining whether you're a candidate for bariatric surgery is a process that requires serious discussion with your primary care provider and your family. It's a decision that cannot and should not be taken lightly. Here you'll learn more about choices in bariatric surgery and how it impacts your body, your lifestyle, and what you'll need to do to help maximize your opportunity to take control of your weight and your life. A BMI over 40 indicates that an individual may be a candidate for bariatric surgery. Generally, a BMI over 40 translates to 100 pounds or more overweight for men or 80 pounds or more for women. Bariatric procedures may also be an option for people with a BMI between 35 and 40 who have comorbid conditions such as hypertension, diabetes, or sleep apnea. Your process may include transitioning from the medical weight loss team to the surgery team, a referral from your primary care doctor to the surgery team, meeting with the surgeon first, or meeting with the nurse practitioner and the dietitian, whether it's online or in person. Whichever way, we're glad to have you. The timeline to surgery includes an initial consultation and then a follow-up on your dietary changes and adherence. Testing may be required, including an endoscopy, blood work, a nutrition class, a psychological evaluation, follow-ups, insurance coverage, and then meeting with the surgeon and getting your surgery date. If you are currently under the care of a specialist, like a cardiologist, a pulmonologist, or a psychiatrist, you may require a letter of support. All patients are asked to follow some dietary changes prior to surgery and show that they are able to comply with those changes before their operation. It is required that you lose weight prior to surgery and pass a mental health evaluation and show that you have a strong support system. All patients must be nicotine-free for a minimum of 3 months prior to bariatric surgery and pass a nicotine and drug toxicology screen prior to being approved for weight loss surgery. All problematic drinking must be addressed prior to surgery, and patients must agree to avoid alcohol for a minimum of 6 months after surgery to reduce the risk of addiction transference. To understand how bariatric procedures work and how they differ, we start with a basic understanding of how the digestive system works. Normally, as food moves along the digestive tract, appropriate digestive juices and enzymes arrive at the right place at the right time to digest and absorb calories and nutrients. After food is chewed in the mouth and swallowed, it moves down the food pipe or the esophagus into the stomach, where strong acids continue the digestive process. The stomach can hold about 3 pints of food. When the stomach contents move through the valve, the pylorus, into the small intestine, the duodenum, bile and pancreatic juices speed up the digestive process. Here, calcium and iron is absorbed. The next part of the small intestine, the jejunum and the ileum, complete absorption of most of the calories and nutrients. Food particles that cannot be digested in the small intestine are stored in the large intestine and then eliminated. The surgical treatment options offered at UNC, Chapel Hill, and Hillsborough include sleeve gastrectomy and ROUX-EN-Y gastric bypass surgery. Bariatric surgery is performed under general anesthesia. The surgeries are performed either laparoscopically or robotically in Hillsborough or in Chapel Hill. The vertical sleeve gastrectomy, or sleeve, is a restrictive operation that reduces the stomach capacity by removing 2/3 of the stomach, which lowers hunger hormones and controls appetite by reducing the amount of food that can be comfortably eaten at one time.
In a sleeve gastrectomy, part of the stomach is separated and removed from the body. The remaining section of the stomach is formed into a tube-like structure. This smaller stomach cannot hold as much food. It also produces less of the appetite-regulating hormone ghrelin, which may lessen your desire to eat. However, sleeve gastrectomy does not affect the absorption of calories and nutrients in the intestines.
Vertical sleeve gastrectomy surgery takes about an hour to perform, and most patients spend 1 or 2 nights in the hospital. This surgery does not cause any malabsorption. There are less vitamin deficiencies when compared to gastric bypass. The typical weight loss is approximately 50% of the excess body weight. The second surgery is called ROUX-EN-Y gastric bypass. As this surgery implies, the surgical procedure routes food past most of the stomach and the first part of the small intestine. In addition to restricting food intake, it also reduces nutrient absorption.
In ROUX-EN-Y gastric bypass, the surgeon creates a small pouch at the top of the stomach. The pouch is the only part of the stomach that receives food. This greatly limits the amount that you can comfortably eat and drink at one time. The small intestine is then cut a short distance below the main stomach and connected to the new pouch. Food flows directly from the pouch into this part of the intestine. The main part of the stomach, however, continues to make digestive juices. The portion of the intestine still attached to the main stomach is reattached farther down. This allows the digestive juices to flow to the small intestine. Because food now bypasses a portion of the small intestine, fewer nutrients and calories are absorbed.
This surgery takes up to 3 hours, and most patients spend about 2 nights in the hospital. The typical weight loss with a gastric bypass is approximately 60 to 70% excess body weight. For example, a 5'5" person at 250 pounds carries approximately 125 extra pounds on their frame. Their goal weight after gastric bypass surgery is approximately 170 pounds. Risks associated with gastric bypass may include dumping syndrome, iron and calcium deficiency, stomach ulcers, and hypoglycemia. Both bariatric surgeries present risks including nausea, vomiting, gas and bloating, lactose intolerance, temporary hair thinning, skin sagging that may not be covered by insurance to have excess skin removed, vitamin deficiencies if a proper diet and taking nutritional supplements is not followed by recommendations, changes in bowel habits, and increased fertility. Therefore, birth control is required in women of childbearing age who are sexually active for at least 18 months after surgery. Surgery risks include infection, dehydration, blood clots, hernias, irreversibility of the procedure, and death. Reduce pain by walking shortly after your surgery. This also reduces the risk of pneumonia and blood clots. You'll also be given medication by the surgeons in the operating room. You'll have a reduced risk of constipation by taking the recommended stool softeners or laxatives. Alcohol must be avoided for 6 to 12 months after surgery, and you must permanently refrain from smoking. Most patients can return to work after 2 to 4 weeks and are usually able to drive after they are off of their pain medication. There is no guaranteed amount of weight loss from bariatric surgery. Weight control is the personal responsibility of the patient having the operation. As is true for other treatments for obesity, successful results depend significantly on knowledge, personal motivation, and behavior. On behalf of UNC Bariatric Surgery and our prestigious credentials, Center of Excellence, with over 20 years of experience, we welcome you to the Bariatric Surgery Program. We encourage you to learn more and to join our Facebook support group. Thank you.